Hello. Hello, everyone. We're just going to give it a minute while people are just joining us. Everyone gets a little settled and then we'll get going. All right, looks like we can go ahead and get started. So thank you all for joining us today for our information session for our pharmacy programs. My name is Michaela. I am one of the admissions counselors on our Worcester campus. Today's webinar will be recorded, so if you have to log off or you miss any part of the session, no worries, it will be recorded and posted as well, so you can always refer back to that. But yeah, let's go ahead and start off with some introductions. As I already mentioned, my name is Michaela. I will pass it off to our other counselor.
Hi, everyone. My name is Christine Kademi. I'm the Associate Director of Admissions here on our Boston campus. So primarily working with our students interested in the PharmD program in Boston, which is our direct entry program. And we'll go more into that in a little bit.
Awesome. And I should have also mentioned, I also work directly with the Accelerated PharmD program on both our Worcester and Manchester campuses. Krishna?
Thanks, Michaela. Hi, everyone. My name is Krishna. I'm a second year accelerated pharmacy student on the Worcester campus. Yeah.
Awesome. And last but not least, Jen?
Sure. Hi. So I'm Dr. Toll. I'm one of the pharmacy faculty members on the Worcester Manchester campus. So I teach in the accelerated program. I'm also an alumni of the Manchester program. So have been a student there as well as now teach.
Awesome. Thank you all very much. We're very pleased to have everyone here today to talk about our university's program offerings through our School of Pharmacy. During the session, we will be talking a little bit about the university, the different pharmacy programs we offer, how to apply, and we'll also include some times for question and answer session if anybody has any questions. And when we do that, you can feel free to throw any questions that you do have into the Q&A session. You can actually do that at any point through the session. If you have any questions, feel free to just throw it into the Q&A function. All right, so let's go ahead and get started. So for those of you who are new to the grad school search, healthcare is definitely a great field to get into right now. Not only is healthcare one of the largest employers in the US right now, but it's also an aging population. Job openings are projected, and there's an increase of this over the next there's a projected increase of this over the next decade or so. So it's definitely a great time to go into this field. MCPHS is also a healthcare specific university. So we offer 100 programs in different fields, and it is definitely one of our specialties. Many of our faculty have clinical sites where they work part-time as well. So our faculty members are definitely hands-on while also being here for the university. Being active providers, they are up to date on the current healthcare system. Additionally, the students around you are working towards other healthcare professions as well. So we have other things like physician assistants, things like that. Through school sponsored events and other social activities, you have the opportunity to learn about different healthcare professions even before entering into the field as well. Especially on our campus, we have a lot of opportunity for that. So if that is something you are interested in, you definitely will have the option to do so. One thing we like to just pause here for and ask to Dr. Toll is, what would you consider is the current landscape in pharmacy, and what are we seeing for the future?
Yeah, pharmacy is, gives you a lot of skill sets when you complete a pharmacy degree and pharmacy program. And so there's a lot of different spaces to go into. I think a lot of times people think about pharmacy, they think about community, pharmacy, you go in, you see your pharmacist, you pick up your prescription. Um, and sometimes people are aware that there's hospital pharmacists. You don't see us as much. I'm a hospital pharmacist. We work kind of in the background with the team, but there's a lot of other spaces that pharmacists are getting into and are involved in, much more in the drug development field, working in the federal government in different places such as the FDA, the CDC. We work in places like poison control, giving advice on overdoses and toxicities of medication. So there's a lot more space. And I think one of the big growing areas that we're seeing is kind of a little more of a hybrid between community and hospital. So there's a space called ambulatory care where there's a lot of growth kind of in that space. So a lot of specialty drugs, kind of you provide education, you meet with patients, and it's kind of like working almost in a primary care doctor's office or specialty doctor's office where you're working with a team of healthcare providers, but you're also getting to meet and make relationships with patients. So that's a big area that I see growing and has been growing for a few years now.
That's great, Dr. Hill. Thank you so much for sharing that with us. Yeah, pharmacy is definitely a growing department, so that is fantastic. Um, One of the other things we do like to mention is our students find job placements soon after graduation, some even receiving job offers before they graduate, which is fantastic for the outcome of our students. As future pharmacy applicants, you may be aware that the profession has been ranked among the top healthcare careers by the US News and by World Report for several years now, which our pharmacists are also ranked as number 15th for best healthcare jobs in 2024. So it's definitely a high-ranking job, a good field to go into. MCPHS also ranks among the top pharmacy and pharm sci schools in the nation and has been distinguished as a top university for return on investment as well. So students graduating have a very number, as you can see on our slide here, number 3 in the US for return on an investment. We realize that returning to school for your master's degree will be an investment for both your time and your money, but based on the current job outlook, future job security, and quality of education MCPHS can provide, we believe this will be a good investment for your future. All right, let's go ahead and take a look at our campuses. So we offer pharmacy programs on all 3 of our campuses. So our Boston, Massachusetts, our Worcester, Massachusetts, and our Manchester, New Hampshire campuses. One of the really neat things about MCPHS is that we've been here for a long time. The university just celebrated our 2000th anniversary actually last year. We started with just pharmacy programs in Boston, which is now the oldest school of pharmacy in New England and second oldest in the country. And we now have over 7,500 students between all 3 of our campuses, including our online branch as well. We're going to go ahead and turn it over to Krishna for a minute to talk about, if you wouldn't mind just sharing why you chose your campus and what you like specifically about it, or maybe what your favorite thing is in the area.
Yeah, definitely. So I think typically people are drawn to the accelerated program because it is the shorter PharmD option amongst the 3 campuses. I guess Manchester also has the accelerated, but that's typically what I'm finding, and it rings true with me as well. I also knew, so I'm from Canada, and I also knew that I was very interested in research, and I hope to pursue a career in the drug industry after I graduate. This area is very, very saturated with so many drug companies that are here. And I knew I wanted to benefit from the name of MCP and the area that I'm in. Something I can share about the campus, I really like what it's like, the community of students here, especially. But otherwise, I think it's always nice to go out for a run. I think it's really easy to just step outside, and there's a lot of green spaces on campus. So, yeah.
That's awesome. Thank you so much, Krishna. Yeah, I can definitely back her up on the community. At all 3 of our campuses, honestly, they all have sort of a unique kind of community, and they all just have a really good sense of whether it be helping your classmates, helping even people in other programs sometimes. Everyone is just very close-knit, it seems, at all 3 campuses, which is a lovely environment to have, especially when you're going into a graduate program. So that's great. And then I just want to mention the quick facts here on the slide. So for Boston, Boston is definitely a place where you find world-class healthcare centers. So there's, I'm sure you've heard of many, like Boston Children's Hospital, Beth Israel, those are all right there. They were founded in 1823, as we mentioned before, our first campus, and they have over 4,500 students. The Worcester campus, also very close to many healthcare opportunities. We have UMass Memorial and St. Vincent's literally a step away from our campus. That was founded in 2000, and we have about 1,600 students. And then our Manchester, New Hampshire campus, which is set in Manchester. And they have a little bit of a smaller campus vibe and a really close-knit community there. They were founded in 2002 and have about 500 students there. All right, we're going to go ahead and talk a little bit about the programs now and just highlight the different options we have. I'm going to go ahead and first hand it over to Christine to talk about our direct entry on our Boston campus.
Awesome. So just to reiterate what Michaela was saying and what Krishna was saying about pharmacy and the opportunities Krishna had mentioned, just being saturated within Massachusetts. So if you're not aware, Massachusetts has 50% of the biotech and pharmaceutical industry in Massachusetts in general, not just Boston, but Massachusetts. So, where we are with MCPHS and our 3 campuses, you really can't go wrong pursuing a career in pharmacy with us. So to talk a little bit about the differences, so I'll first talk about our Boston campus. We have a direct entry program. So the reason we mention this specifically is because the way that this pharmacy program is structured on our Boston campus is a 6-year doctorate program. So when I'm working with students, we have an entry that students can jump in either right after they graduate high school, and it would be a total of 6 years. We have an entry point for either your pre-professional years of an entry of year 1 or year 2 to the undergraduate side. So that is either, like I said, right out of high school or a transfer student. And then we also have the option to enter P1, which is the professional year. So then that would make it, if you are looking for that P1 entry, that would make it a 4-year program for you on our Boston campus. We do also have an honors program available for our Boston campus students. So the honors program is specific to our PharmD program. And the way that it's designed is for high achieving students who are looking to add research and the potential to be published or present at a conference. And so this is something where a student would opt into the honors program, would apply, and then have the opportunity to be paired with a faculty member to have them as a mentor and help them, like I said, potentially present or get published, but have that focus in research. And then, as I said before, this bullet point here about freshman entry is available. So no matter where you are in that spectrum, whether you're a high school student, a transfer student, or a student who already has a bachelor's degree, we have a lot of different entry points for you in Boston. The accelerated program is a little bit different, so I can pass that back to Michaela to talk about that.
Thank you, Christine. All right, let's go ahead and talk about the accelerated program. So that program is offered on both our Manchester, New Hampshire and our Worcester campus. This program is considered accelerated because we go through the summers. So we work during the summer semesters where Boston has the summers off. So that's why they're non-accelerated. For the Worcester Manchester Accelerated Program, this is a 34-month total program. The first 2 years are didactic, so where you're taking your coursework and things like that. And then you have 10 months of your advanced clinical rotations. This program is also professional entry only. So as Christine was just kind of going over a little bit for Boston, they have that, they have the pre-professional phase. The accelerated program is just the professional entry only. So that's something to keep in mind when you're looking which one you're looking to kind of apply to based on like your qualifications and things like that. We are going to go ahead and ask our students and faculty some questions that we find helpful for this part of the session as well. So the first thing I want to go ahead and ask Krishna, if you wouldn't mind talking about, is to describe our interprofessional education, or IPE, and what's your favorite experience that you've had so far?
Yeah, definitely. So just to kind of explain what an IPE interaction is, basically, we know that MCP is like it consists of multiple different healthcare faculties on campus, and we actually have inbuilt opportunities in our curriculum to meet with the students that are around campus and actually around the city as well, to just kind of talk about their experience in healthcare. For example, we had a book discussion with other faculties. We had um, early on in our first year, we actually had a discussion on like what kind of roles that different faculties hold. I think that was really eye-opening for me. I got to meet, the sonography team. A lot of my optometry friends were there, and I actually learned that optometrists can give vaccines, and I had no idea because it really puts into perspective because anyone that we kind of miss seeing, the optometry people will get, or vice versa.
That's great, Christian. Thank you so much. Yeah, our IP is definitely I would say a fan favorite among our students. It's a nice event that I know that they look forward to during the semesters. So that's great. Do you mind also, Krishna, speaking a little bit about, well, actually, I'm maybe you can't speak too much about this, but clinical sites. I know that maybe you can a little bit.
Yeah, definitely, definitely.
Okay.
So I just had my IPPs, which were my intro rotations, and my first one was at UMass Memorial, which is just a hospital, right? It's like 10 minutes away from me walking. That one was really great, actually. That was my first experience with institutional rotation, and I actually had a chance to go on patient rounds as well. And I thought that was really just something else. It's like we like in class, well, Dr. Toll knows this, but we like cover like patient cases in class. But this is completely different. We're like meeting patients and we're hearing about their side as well. It was really a unique experience.
That's so awesome. Yeah, it sounds like it already feels like you're kind of already doing it in the real world, which is fantastic. Good for
Yeah.
you.
Yeah,
Awesome.
my other IPPY rotation was actually at a community rotation. It's called Family Health Center of Worcester and it's nearby as well. A lot of the pharmacists there were actually students at MCP, not just at Worcester, but from Manchester and from Boston as well. So I thought it was very cool to hear how school has changed over the years. But
Absolutely.
yeah, yeah.
It just goes to show you too that, you could end up in a place like that if you wanted to, if that's something you wanted to do, that students, graduate and get a position like that, which is awesome.
Yeah, exactly. Yeah.
Great. Well, thank you so much, Christian. That's awesome. I'm going to also send it over to Dr. Toll to answer one of our questions for us. What would you say makes the pharmacy program at MCPHS unique?
I think there's a lot of characteristics. I mean, I think a lot of the pharmacy curriculum, if you look at the curriculum, we all have to follow the same accreditation. So we all have to meet the same standards. But I think honestly, the faculty make a huge difference. We have a very long standing faculty group. I've been teaching now for 11 years, and many of my coworkers are people that taught me when I was a student. And so, that longevity and knowing how to teach and knowing how to transcend that information, I think they make it feel achievable. I feel like they give you the support that you need. And so I enjoy working with my coworkers. I enjoy being a faculty member and kind of helping to support the students. It definitely feels like a community, which is nice. And then obviously, I think having the other healthcare professions is really helpful too, because when you do leave the school and you go out in the real world, you're not working in a silo. You're not just working with pharmacists. You're working with all these other people. And so to have us kind of talk about it, and Chris and I had to have you like experience the IPE, events that we put on, but then go out into, rounds at the hospital. Now you're actually working with all those people and you're hearing their thoughts and their points of view. And like to be able to kind of see that in real world action, I think is really helpful. So I think that makes a big difference.
Absolutely. Yeah. Thank you so much for sharing that. I definitely have noticed myself how beneficial it is for those faculty members who have been here for so long, they've seen everything, so they kind of know how to do everything, which is so beneficial when you're in a program like this.
Yeah. And we still clinically practice, which is nice because as things change, you kind of see like what's happening, and then like you can bring that back to the classroom, you know, and talk about it.
Absolutely.
Yeah.
Yeah, always adjusting and editing for sure.
Yeah.
Awesome. Well, we'll also see, can you also speak a little bit about residencies and fellowship opportunities that students can have after they graduate?
Yeah, so for some students going into pharmacy, obtaining their PharmD and graduating is enough for them to obtain that position, whatever that job is in the end. There's some licensing exams that you take, and then you kind of move on. For some students, they want to specialize a little bit more, so there are what we call postgraduate opportunities for students. And during your time in pharmacy, school, MCPHS, one of the things that we like to do is bring in guest speakers on from different backgrounds, kind of hear about how they got to the positions they're in. And for some of the specialty things that are happening, going on to do these postgraduate opportunities is helpful. So if you identify that's what you want to do, residency is one. Residency is usually a year long, and it's kind of extra training after you graduate, and it's usually specific to either management in community or hospital, hospital pharmacy. Um, Fellowship is generally geared more towards industry, and usually it's 2 years. So industry would be like manufacturing, and there's a variety of different roles that you can apply to. So throughout your time, you get paired up with a faculty advisor, and a lot of our advice is really trying to ask you questions about what it is that you want to do in your future, and then helping you to get to that goal. So if one of your goals is residency, there's a number of us that have gone through residency. Some of us work to support residency programs currently, so we can provide a lot of feedback around that. Another set of us as faculty also help with fellowship programs. So MCPHS has the second largest biopharmaceutical fellowship program in the country, and many of us mentor fellows. And so this again is a postgraduate opportunity. You go and work in industry, kind of learning the landscape over a few years, and then can kind of jump right into working for a pharmaceutical company, helping to bring drugs to market. And so I've done a residency, so I meet with students a lot to talk about that process and what it looks like. And I also mentor fellows for Pfizer. So, and I've been with that program for about 8 years. So have some exposure and experience kind of on that realm. But our students go into both areas, as well as, going into many other paths as well.
Great. It's great that there's so many different pathways, because I know that a lot of different students have different things that they want to do. So that's
Mhm.
great.
Yeah. Yeah. And
Kind
throughout
of
your time, you learn about those, and then you can figure out what you want to do. You don't have to know going directly into pharmacy school.
right. Which is nice, because then you can also kind of change maybe your opinion a little bit on some things too, which is great. All right, kind of going along with that, Krishna, would you mind talking a little bit about what organizations you've maybe been involved in or heard of some?
Yeah, definitely. So I guess I can start with APHA. APHA is generally just a large pharmacy organization. It's North American wide, and in APHA, I am the chair of substance use disorders. Um, substance use disorders has been like a pretty big focus of mine, and I really like to focus on harm reduction specifically. So I just thought this would be something I could be involved in. Um, I'm also the vice president at IPHO, which is for the industry pharmacists. And I guess that it kind of does really align with my future career goals. I found that it really gets me into contact with people that have been in the same spot as me, pharmacy students that are kind of considering industry. So I think that could be something that any of you are interested in and you could look into. And then I'm also the president at ASCP, which is the American Society of Consultant Pharmacists. We focus on patients that are geriatric or maybe have a lot of medical conditions. And we like, the Worcester campus, we specifically like to focus on deprescribing because Dr. Bartlett is very big on that, who is our advisor. Yeah, I think I think it's always good to be involved on campus. It really gets you into contact with so many different people you would not have on your own, maybe, and it gets you exposure into different fields that you might not have experience with before.
Yeah, absolutely. And it also kind of gives you a broader community as well, because you could be in organizations with students that maybe aren't even in your program, as kind of Christian was just touching upon there, and expand your kind of network there, which could be beneficial to your studies as well.
Right.
Awesome. Thank you so much. Something I wanted to ask you, either one of you, if you want to touch upon, or both of you, if you'd like to talk about it, is our research opportunities that we offer for our students. If you wouldn't mind touching upon that.
I'll let Krishna go first.
Thanks, Dr. Toll. Yeah, I can definitely speak on research. So throughout my undergrad, I knew I liked to do research. So one of my reasons I came to NCP was because the one-on-one interaction that I can have with the professors, I think it really does facilitate any student that is interested in research. So my first research is with Dr. Timothy Ongst, and we focus on digital healthcare, and we recently just got published. So yeah. My next research is with Dr. Robert Campbell. We're doing low-grade ovarian cancer. We're trying to find new treatment therapies that can maybe target low-grade ovarian cells without the toxic effects of the current first-line treatments. And then I'm also involved with research with Dr. Prashant Mandela. We're using Drosophila, so fruit flies, as a model for depression in humans, which I thought is really interesting. Yeah.
That is super interesting. I want to hear about this more once you do more research into it, because that is really interesting.
I'll let
That's
you know.
awesome. Those last two ones sound really interesting to me, so that's great. All right, Dr. Toll, did you have anything to add to that?
Yeah. Krishna, you're doing both literature type of research as well as bench research. One of the distinguishing sort of factors, I think on the Boston campus, on the Worcester campus, there is more bench research opportunities. In Manchester, we don't have the facilities for bench research, but as faculty, we all have to do research. And so sometimes it's clinical research based on our API rotation sites. Sometimes it's literature-based research, so looking into maybe a disease state and kind of what's new, teaching methods. There can be so many different ways, but no matter which campus that you would choose to go to, there's always research opportunities to get involved in. If you're interested, definitely reaching out to faculty is a good way. But we also have a little mini lecture when you first start to tell you kind of some of the ways that you could get involved in research, so that you're aware that that exists and you can seize that opportunity if it speaks to you.
Absolutely. Thank you so much. Yeah, that's great to know, especially for students who are considering which campus they want to apply to, that they have options for both. So that's fantastic. Awesome. All right. One last thing we like to just ask here, Krishna, for you to touch upon. One of our favorite questions that we like to ask is why you chose MCPHS for your pharmacy school.
Yeah, definitely. I think I've kind of been dancing around it for the past 30 minutes, but yeah, I want to come back to the main point. I know this area is very big in drug industry. I knew that when I was applying. I know that MCP has a very, very like long-standing name. Everyone knows someone that either went here or, like is very heavily involved with MCP. Yeah, I think you can really benefit from the name that you're studying from. That's definitely one. Yeah.
Yeah, and I definitely think it goes back to what you were saying before about the community as well. That's the big thing,
Yes.
especially at
Yeah.
MCPHS, that and that kind of, in my opinion, and I think a lot of our students trickles down to everything else that you do while you're in a graduate program. If your community is helpful and supportive, you will be okay, which is fantastic for our sake.
Yeah, no, that's a really good point because everyone I've spoken to here as students, they've all said that everyone at the admissions office is so like communicative, so responsive and receptive, and it's the same with the professors. Everyone's ready to help you. They're so like responsive in person, obviously, but also on email.
Absolutely, yeah. The faculty especially, I've noticed, are
Yeah.
very quick to respond and very helpful. So if you ever need help, always feel free to reach out because they will be there to help. All right, let's go ahead and talk about how to apply. I'm going to go ahead and send it over to Christine.
I just want to echo too, I never want to jump in, especially in a webinar and have it switch over to me, but just echo what everyone was saying, you know, I think something that's really important to know about MCPHS is that, yes, we have all of these opportunities, but our professors we're teaching first institution. So our professors' main goal is to make sure that you are prepared to be able to go out into the real world and be the best pharmacist that you can be. And so, as you know, Krishna was just saying, the faculty are there to help you. Dr. Toll probably, I can imagine, has students that are reaching out and you're able to help them and help guide them in the directions that they want. So just knowing that we have this big history behind us, but we have over 41,000 alumni across the US and globally. And so that's just providing you that name. And I always make the joke that no matter where you go, whether it's over to Canada, Krishna, or back to the US here, you're going to find an MCPHS alum. My father was in the hospital and had knee surgery, and his PT walked in and his OT walked in, and I was like, "Where'd you go to school?" And one of them went to MCPHS, and so I said that she could stay on my dad's team. But it's something that, like, I walk down the street and I go to CVS, and I had students from MCPHS have their shirts on that they're the ones that are the farm techs, or they're the, you know, you see that, and so it just really opens it up to that big community. So not to go on and on, but just to really echo that MCPHS is a really great spot to be if healthcare and pharmacy is what you want to pursue. But let's talk a little bit about what that application process looks like. So hopefully you're aware of what the PharmCAS application is. So Pharmacy Central Application System, that's what it stands for. And if you are someone who is applying as a transfer or into the professional year, you may have been familiar with the Common App out of high school. So think of something like that. So it's a central application system where everything that you need for that application is going to be sent directly to PharmCAS. So when we're thinking about the timeline for all of that, we definitely want to have a look at our websites, make sure that you're on the right path, depending on if it's the accelerated program or the direct entry program in Boston, which I believe the next slide will talk a little bit about timeline. But if you're looking for P1 entry on any of our campuses, you're going to submit the PharmCAS application. Along with that application, you will send all of your transcripts from any institution that you have completed college coursework directly to the PharmCAS. You will also have a personal statement within PharmCAS, and you will send at least one letter of recommendation, all to PharmCAS. The personal statement is about 500 to 1,000 words. If you have completed coursework outside of the US, you will need to send a transcript evaluation, which is something along the lines of World Education Services or ECE, which they're evaluating your transcript on the US scale so that we're able to understand the classes you took, the credits, the grades. And if you are a non-native English speaker, you do have a requirement of an English language proficiency exam. We do not require the PCAT. So we do have students who may submit it as part of your PharmCAS application. Maybe you're applying to multiple schools and you have the PCAT in there. We don't consider it because we don't require it. I just want to pass it off to Dr. Toll. What do we look for when we're looking at, you know, applicants? What is considered a strong applicant to MCP?
So things that I look at when I look at an application, I want to see that a student has taken a number of science or math classes together in the same semester. I'm looking a bit at workload, so I don't just look at that, it's not just the GPA, it's not just the workload. We kind of look at you as a whole person. So if I see a student that has done part-time coursework but has been working full-time and they can take more than one science class in a semester, then that could be indicate a strong candidate. If you have pharmacy experience, that's great, but it's not a requirement. It doesn't have to be. That doesn't always check the box. We have a wide range that come into the program. I think it can be helpful when you come in, but I don't think it's not a requirement coming in. So really looking to see, is this someone that's going to be successful in our program? And then when I meet with them and interview for the accelerated program, the faculty will meet and interview. I will go through, just a little bit about the coursework and kind of get some understanding about their study strategies and what that looks like, and so can they meet the rigor of the programs that we have here?
Absolutely, yeah. So looking holistically at an application, interviewing a candidate and understanding, are we setting them up for success? Are they going to do well here at MCPHS? Is pharmacy truly what they want to, we want to make sure that we're putting everyone's best foot forward. So
Yeah.
Thank you for sharing that. So I want to go on to speak a little bit about what we're looking at for a timeline. So when you're thinking about applying for pharmacy, all three of our campuses have rolling admissions. So if you're looking for that fall of 2025 start, absolutely start applying now. The PharmCAS application is open. We do have a deadline of June 2nd. For the application, I know when we're looking at our accelerated students, we have a priority application deadline of May 1st. If you apply by May 1st and are admitted, there's a higher renewable merit scholarship for you. But June 1st, June 2nd is just around the deadline for all three of our campuses. So something to keep in mind. As Dr. Toll was just saying, we're looking holistically at an application. So yes, GPAs are important, your interest, your experiences, your motivation, how you perform in the interview, all of that is taken into account when they're considering an applicant. Like I said, so we're rolling admissions, which means you submit your application, it gets verified by PharmCAS and gets sent to us here in admissions. We review that application. If you're eligible to interview, you'll be sent an email to do a invite-only interview, which we have a ton of different opportunities. I know with Boston, we have them every single week, 4 days a week. In Manchester and Worcester, we have them every single week, 2 times a week. So it's something that is definitely, as I said, with rolling, you get invited to interview, you can do that quickly and then get a decision pretty quickly. So something that's really important. We do require you to do a writing sample in Boston. So that's something that you're given a prompt, given a writing sample, and you would send that prior to that. So just a little bit of a difference between the campuses there. We do have different prerequisites for the campuses. So depending on it's the accelerated program or the direct entry program in Boston, you want to make sure that you're looking at the specifics that we require. Everything is listed on our website. All of the prerequisites require a C or higher. C- doesn't count. It is a C, C+ or higher. Courses can be listed as in progress. We always try and recommend no more really than the time that we're at right now, 3 in progress courses is probably okay, but the closer we get, to that June 1st to the start of the fall semester, you really want to have most of those prerequisites completed. But typically we're looking, for no more than 2 to 3 prerequisites listed as in progress. In regards to those prerequisites, math and science prerequisites have a 10-year expiration. So a 10-year expiration for when you plan to matriculate. So if you're looking at fall of 2025, nothing prior to 2015. You'd have to retake those classes to be considered. All right, so let's talk a little bit about financial aid and scholarships. So we do encourage everyone to submit a FAFSA application. For the 25-26 academic year, FAFSA will open up December-January timeline. So you don't have to be an admitted student to submit FAFSA. We always just encourage you to submit FAFSA at MCPHS as a school. If you're admitted, we can process it quicker. If you've already been admitted, we'll have you in the pipeline to process it. So you know, it's always good to submit FAFSA and see what you're eligible for in terms of the federal loans. If you're looking at graduate, you're going to be submitting the graduate FAFSA, but if you're on the high school or transfer side, you're looking at undergraduate FAFSA, which here in admissions, we are trained in financial aid. So I'm happy, and Michaela are happy to meet with you and discuss where you fall, what's beneficial. Along with that also comes the discussion of scholarships. So if you are admitted as a pharmacy student, you will automatically receive a scholarship. And so, as I mentioned, for our accelerated program in Worcester and Manchester, there is priority review for students who are applying before May 1st. But if you are admitted, you're going to receive that scholarship letter, and we're happy to chat with you about that. We also, as I mentioned, are happy to do what we call affordability appointments, which are appointments with us here in admissions or one of our student financial services counselors to talk about a detailed breakdown of what the cost would be, what your FAFSA is, what your scholarship is, so that you can make the best decision for yourself for, you know, where you're going to be going to pharmacy school, what you're putting in. But as Michaela said in the beginning too, just know that we know that you're investing your time and your money into pursuing this education, but it's going to come back tenfold to you because MCPHS has been ranked number 3 on return on investment, between number 2 and number 3 for the last few years, which means that our students are able to pay back their loans faster than the majority of students in the US. So yes, you are putting your time and your money into it, but you're going to be able to come out with a lucrative career, pay back those loans, and be a successful pharmacist, and maybe come back and teach like Dr. Toll. So all really great things. So I'm gonna just pass it back off, just so you know, these are the contact information of our main individuals. You'll notice that neither Michaela or I's information is on here because we actually have colleagues who do this program every single day, but you can always reach out to any of us here. But just so you know, you can always visit our campuses, our Worcester campus and our Manchester campuses. Michaela, correct me if I'm wrong. Worcester has an upcoming open house. Manchester has an upcoming open house.
Manchester's is this Thursday.
Yeah, actually, I could take over and talk a little bit about those too. But as Christina, as Christina's saying, you'll see Julie on here as the Worcester person for right now. She's actually on leave, so if anybody has questions for the rest of the year, you can feel free to reach out to me. Same way, it'll be my first name .macneil@mcphs.edu if you have any questions there. And Amy is the counselor currently helping Manchester. So that is the same. And then for Boston, Christine is helping. So the same thing, it would be her first name her last name @mcphs.edu if you wanted to reach out to us in the meantime while Julie and Ryan are out.
Both of them are on family leave. They're both had children, so they're at the same time. Apparently they planned it, but we are always happy to help.
Yes, absolutely. And if you ever are struggling with that, if you send them an email, it'll get forwarded to us anyway, so it should be fine. But yes, our open house events. So our Manchester one is this Thursday on our Manchester, New Hampshire campus. It will be from 5 p.m. to 8 p.m. If you would like to join us, we would love to see you there. Our Worcester event is obviously on our Worcester campus. That will be on November 14th from 4:30 to 8 o'clock. You can register for these on our visit page on our website. They are really awesome events because you get to, we'll have a student panel for all the programs. So you'll get to hear from a student from each program. We'll have a program breakout session where each of the programs will separate and you'll get to do something with your individual program. We'll have some food, some mingling time, and then also brief little tours of the rooms and stuff that you would likely be in if you were admitted. So if you can make it, it is a great day to do so.
And just to jump in as well, so the Boston campus, whether you're applying to the pre-professional phase or the P1 phase in Boston, you're considered a transfer student. So we actually have a transfer student open house on Saturday, November 23rd. So please feel free if you want to come to the Boston campus. It's exactly the same layout as Michaela was just saying. So please feel free to sign up for that. Our website, if you just go to mcphs.edu/visit, has all of this listed on there with easy clickable links to register.
Awesome. Thank you so much, Christine. Great. So as I mentioned a little bit earlier, if anybody has any questions, you can go ahead and pop those in the Q&A for right now. We have a few minutes left here. We'll go ahead and ask just some questions that we do like to ask in the meantime. But like I said, feel free to throw any questions in there while we're chatting about these. So, Krishna, Dr. Toll, if you want to jump in here and talk about what is one piece of advice that you would give a future pharmacy student?
Yeah, I can definitely jump in on this. I think so. I was definitely in your shoes as well. So I was also on an info session, and I did have a couple of one-on-one meetings as well with current students. And I think I took for granted like how much free time I had before coming to the program. I kept hearing like, "Oh, you will be busy," and I don't think I'd realized like the true like degree of that until I got here, you know, got through my first semester, and then it's really just nonstop. Yeah, I think you just really have to be ready to be busy, I guess. It's nothing that's not manageable because there's so many generations of students that have done this before you. I mean, you'll see like the class above you and the class above them. They've all done the same stuff, and you know, everyone's here to help you. You have a professor here to help you. So yeah.
I think some going on what Krishna said, I think time management is a big piece of the puzzle. And so just gaining some time management skills as you're preparing and just figuring out what kind of a system might work for you to keep track of deadlines or where you need to be or when you're going to study. And we'll give you some guidance coming in too. We try to give you some guidance on tips on that. And then I think really as you're preparing and maybe even still taking classes right now, really getting to understand what kind of a learner you are or how you learn different material best. Because if you can come in with good time management skills and good study skills, then that is definitely a huge key to success in this program. We'll continue to help you with those, so we help you hone as you go. But there is a little bit of a transition from undergrad to a graduate program, and so you know, the first semester I think this is a little. I call it the deer in the headlights semester. It's where just kind of you're trying to figure it all out and get the pieces, and we're handing you different pieces to kind of build up those skill sets. But I think really trying to understand yourself as a learner and develop those time management skills before you come in will be a key to being successful.
Absolutely. And alongside that, I've actually heard some students who say that they recommend coming in with an open mind too. If you have a study habit that you think works really well for you in your undergrad, or in your, let's say even in high school, it may be a little different when you're going into graduate school. So you may want to consider, like, if you go into your first semester, something's not working, listen to Dr. Toll, get the advice from her or other faculty members on what works for other students and give that a try, because it could be really beneficial for your graduate study specifically. Awesome. Let's see. Okay. Krishna, would you mind talking a little bit about what is one thing that has surprised you about pharmacy school?
Other than being busy. No, just kidding. I don't know. So something I think a bit more personal to myself. I think I was a little bit more introverted in my undergrad, and I think I kept more to myself, and I don't think I was as involved on campus. But I think after coming here, I just like I just feel like so deeply that like I'm only here for 3 years. It's such a short time. Like I have to make the most of it. You know, I've moved all this way. Like I have to do something different. So I think that's just something very personal that I've realized about myself, but it's definitely different for everyone.
Yeah, I don't think you're alone there either. I think that a lot of students, you know, come in and they're kind of preparing for graduate studies and they know it's going to be rigorous and tough, but
Yeah.
once you're kind of in it, it goes by a lot quicker than you think. And then all of a sudden you're like, oh my God, I'm a pharmacist.
Yeah,
So
yeah.
it definitely can go quick. I think that you're not alone there. Awesome. All right. Let's go ahead and go back to Dr. Toll for a minute. And again, if anybody has any questions at all about anything that we've covered so far, or even if it's something that we haven't covered and you'd like us to touch upon, you can go ahead and throw that in the Q&A function. but we'll go ahead and ask this other question in the meantime. So Dr. Toll, can you provide some best practice interview tips, especially in the new age of these virtual interviews that we're having?
Yeah, I think even with it being virtual, coming prepared, I think coming prepared to have a conversation. Like, I think it's hard. Sometimes you have notes and you kind of type them up, and now you can like dual screen, put your notes up here. But essentially, I just want to talk with you. Like, I want to answer your questions. I would love some answers to my like just kind of have a conversation. I think dressing, professionally, at least, the areas that the interviewer is going to see, coming with questions that you have for the program, because it's really about finding the best fit for you. And so I think, bringing those questions with you and kind of just being engaged, I think that that's helpful. We get that sometimes, you may have a roommate or, being virtual, you never know what's going to pop up. And I think we're pretty flexible with that, cats popping into the picture or kids, that's kind of just the nature of what we expect. And so, don't get overly stressed about those things. But if you can kind of find a little bit of a quiet place to just sit and have a conversation, and come ready for that conversation, I think that's good. If you have any blemishes, in the past, maybe you didn't do so well, your first semester in college, and then you figured it out. I think being able to just explain that, like what happened, we get that everyone's human, and some of us didn't have great first semesters, and that's okay. We're not looking for perfection. We're really looking for a person, and a person at this point that's just ready for this next adventure. So
Absolutely. Those are some great tips as well. I think that our students can definitely benefit from hearing those things. So that's fantastic. Thank you so much. Thank you to both of you, actually. You've been very beneficial sharing those things. All right. It doesn't look like we have any more questions, so we will go ahead and let you guys have a good rest of your night. Again, I want to thank everyone for being here. Krishna, Dr. Toll, thank you so much. And Christine, of course, my information session partner. Thank you all as well for attendees for being here tonight. Again, if you have any questions at all, feel free to reach out to us. We'd always be happy to help, and we hope you have a good rest of your night. Bye.